Morning again, everyone. Great to see so many friends and partners in the work for LGBTQ equality on a beautiful Tuesday morning. At least it's beautiful in Ravenswood. So, and the windows are open and it's lovely outside. So thanks for joining us for a little bit to hear about what's happening in legislative session down in Springfield, or remotely, I guess, this remote legislative session, not so much down in Springfield. And it's one that's really jam-packed for advocates of LGBTQ equality and just really great legislation that is going to keep Illinois a leader in the country when it comes to LGBTQ equality and inclusivity in so many facets and aspects of life. So if it's okay with everyone, I'm just going to well, first of all, let me back up and introduce myself formally, because I know many of you, but we may have some folks I haven't met. And my name is Mike Ziri, he, him, his. I'm the Director of Public Policy at Equality Illinois, and I've been with the organization for about 6 years and a few months now. I like to say I'm the most senior member of our team, and an amazing team we have. And as policy director, I get to do the work that I love to do, and that's go to Springfield, or what counts for Springfield now, and advance great laws and great bills that affirm LGBTQ Illinoisans, and then fight whatever bad legislation may rear its head. And Illinois is not immune to bad legislation. And we've just done some exciting work in the past and looking forward to do some exciting work, but we can't do it without your support, your friendship, your partnership. So thank you so much for everything you do for LGBTQ equality and Equality Illinois in particular. So I'm just going to jump in. I'm going to share my screen here. Hope this works. All right. So let's start. So we've already done introductions. Just a little background on when we talk about LGBTQ folks, who we're talking about. It's about 4 or 5% of the population of Illinois that are LGBT adults. So obviously we know it's more folks than that, because we know more and more young people are living authentically and coming out. I just saw a poll, I think it was the Gallup poll, that said that a sixth of Gen Zers who are age 18 to 23, 1/6 of them, so about 16-17%, are LGBTQ. So these numbers are for adults, but we know they're more in Illinois. And so we advocate for that population, those members of our community across the state. So from Carbondale to Chicago, from Rock Island to Danville, and all points in between. And when we think of Illinois, Illinois, as I said, is a leader when it comes to LGBTQ equality. And we're very much a leader in the Midwest. And as you can see here, we're surrounded by states that don't have affirming laws or great supports, that aren't where the community is not supported strongly by their legislators and the legislative leaders and their governor. And so it's really important because of that Illinois keeps moving forward across the country. And to highlight that, I just pulled a few of these headlines to illustrate what is happening January, February, March of this year across the country in these states. And what we're seeing is, as we have a new administration in Washington that is extremely supportive and affirming of LGBTQ Americans, we're seeing that the opponents of lived equality, the opponents of justice for the community, are taking their fights back to the states and the state capitals. And we've already seen across the country so many bills introduced this year that would attack especially trans young people. And they're coming in the forms of bills to deny trans students access to healthcare, or the ability to play on student sports teams. And for all the reasons the opponents give for these bills, all these sound bites, at the core of this is really wanting to attack the ability of trans people to have equal rights and to be able to have enriching lives in public spaces. And so, just last night, the Tennessee Senate okayed an anti-trans bill. So the fight goes on in the states across the country, which is why we are adamant that Illinois has to keep moving forward. And as you saw, Illinois is a leader in the country when it comes to LGBTQ equality. We were the last state to pass marriage equality through the legislative process. We have for 15 years now the same protections in state law that Congress is trying to implement nationally through the Equality Act. So those non-discrimination protections, we've had those for 15 years in Illinois. We were one of the first states to legislatively ban conversion therapy. We were the second state to ban the panic defense. And then just 2 years ago, a bill I'm extremely, extremely proud of, we were one of now only 5 states that legislatively say, when you teach history in public schools, it must include the contributions of LGBTQ people so that our young people get a fuller understanding of who developed society, how society developed. And so our LGBTQ youth understand you are not alone. You are not alone. LGBTQ folks have made tremendous contributions in history. And there's a lot to be proud of there. And so we're really excited for the inclusive curriculum law, which was passed 2 years ago and took effect last year. But we can't rest on our laurels. We have so much more work to do. And we at Equality Illinois, with our partners in other organizations, with our partners in our community advisory group, with all of you and advocates across the state, our statewide network, we are continuing to move forward this year. And with a really robust legislative agenda in a year really legislatively unlike any other. It's a year where we have a new Speaker of the Illinois House, Speaker Chris Welch, who in his legislative career since 2013 has 100%, has 100% firmly supported LGBTQ equality initiatives. We have a new Senate president who took the role last January, the Senate President Don Harmon, who has always been a strong supporter of LGBTQ equality. And we have a lot of new voices in the legislature this year, a lot of new faces, many pro-equality legislators who won their elections in November. And so we think there's an opportunity to do big things. And biggest, I think, of all is this bill, which formally is the Responsible Education for Adolescent and Children's Health Act. We call it the REACH Act. And excuse me, it's our top priority with our partners at Planned Parenthood. And basically, it requires age-appropriate, inclusive, comprehensive personal health and safety education, grades K through 12 in Illinois public schools. And what you might traditionally understand this as could be sex ed, but we are broadening that and making it a richer, deeper curriculum based on health, personal health, healthy relationships, safety, violence prevention, sexual assault prevention. So not just what you might consider sex ed. And the reason this bill is so important is, as we've spoken to youth across the state, from Carbondale to Springfield to Naperville to Metro East to Ottawa, Illinois, what we've heard is that, when it comes to the standards and what they're being taught, there's a complete lack of LGBTQ inclusivity. In fact, the exact opposite. Illinois state law right now says that if a school district provides this kind of curriculum, they have to teach, quote, honor and respect for monogamous heterosexual marriage, end quote. That's in state law right now. So the standards need to be changed and updated and modernized to be inclusive and comprehensive. But also we've learned, this kind of instruction right now in Illinois is optional for schools to teach. So young people aren't getting the information they need to lead happy, healthy, safe lives. And they've told us that, as have many other organizations and providers of care for young people. And so with Planned Parenthood, we introduced this bill, the REACH Act, to correct the mistakes of the past, to no longer be incremental in our approach to how we teach personal health and safety, to have a comprehensive approach to require age-appropriate, inclusive, comprehensive personal health and safety education in grades K through 12. Really excited by this bill, and just working with all of our partners and our sponsors to move this bill forward this year and get it done once and for all. to make sure that Illinois is no longer in the minority of states, because 30 states right now require some form of personal health and safety education, but not Illinois. And we are a leader, and we need to continue being that leader, and passing the REACH Act will help, keep Illinois in the lead on issues affecting young people and LGBTQ students especially. But that's our top priority, but we have a lot of other great bills we're working on. And I can briefly touch on these. One of them is a big bill to modernize the birth certificate law, to remove the requirement that someone has to have a doctor's note in order to correct the gender marker on their birth certificate. And so we want to move Illinois to a position of what's called self-attestation. And so really excited by House Bill 9 and the opportunity to move Illinois in, again, to be a leader nationally when it comes to these to identity documents. Another big bill that we're working on with a task force of partners, including AIDS Foundation and Center in Halstead, Chicago House, other groups, is a bill about demographic data collection. And we know that you can't identify disparities and problems if you don't have data. But we also know that there isn't great data on the lives of LGBTQ people. We have some data, but it's not been consistently collected, and it's not collected across the board. So what we want to do here is, with Senate Bill 2133, is collect that data and direct state agencies to expand their demographic data collection practices to include sexual orientation, gender identity, and to also require hospitals to collect demographic data for COVID-19 treatment, testing, and vaccinations. So we have a fuller picture of what's happening, of what disparities exist. As someone said in one of our presentations once on this topic of data collection, if you don't have the data and you don't know what's happening, you can't make the headlines. So we don't know what the disparities are within the LGBTQ community fully if we don't collect this data over time. So that's a really important bill. And then a bill about elections, where there's a requirement right now that if you run for office and have changed your name within 3 years of when you run for office, you have to put your former legal name on the ballot and on the petition. And what has happened is, in the last 2 years, 2 candidates who are trans have had to do this. And it's just a complete barrier to public service. And as an organization that really wants LGBTQ folks and trans folks especially to step up, run for office, and engage in public service to lend their skills and talents to the public good, we think this is an important bill. Few others, right now, Illinois law prevents gender inclusive multi-occupancy restrooms. So we want to correct that, and we want to allow entities to implement these gender inclusive multi-occupancy restrooms if they want to. And if they do, then they have to do a few conditions around privacy and things like that, and inclusivity. But it's we think this is a good business bill, because it allows businesses to better serve customers. And speaking of business and corporations, we want to pass legislation that requires corporations in Illinois to annually report out on the data of for their boards of directors on LGBTQ status, just as corporations already have to do in Illinois around race, ethnicity, and gender. We want to expand that to include LGBT members of the boards of directors. We already do this for state boards and commissions. And we think this is important because we want to be able to help businesses and corporations to build that talent and to elevate those LGBTQ individuals to their boards, to reflect the great diversity, and in doing so, help better serve customers and policy. And then the last bill I want to mention here is just a bill to create a uniform standard for name changes on marriage certificates, because there is no uniform standard, and different county clerks are doing different things, and it's frustrating, and it's messy, and so we're working with Chicago House on this piece of legislation. So as you've seen, there's just so much here happening that we're working on, whether it's working on inclusive spaces like multi-occupancy restrooms, inclusive leadership like corporate boards, inclusive identity documents, whether that's marriage certificates or birth certificates, representation in elected office with the election code bill, and then the all important demographic data collection, and of course, making sure our young people have the information they need to lead happy, healthy lives. So those are just some of the things we're working on this year, all of them in partnership with other amazing organizations, some of whom I've mentioned. But I know there was folks wanted to dig a little deeper on the criminal justice pieces, and I wanted to share a little more information about what we're seeing, including a recent bill that just got signed, a big piece of legislation, and then another piece of legislation that we in Coalition are working on around HIV. We know when it comes to the criminal justice system that LGBTQ people aren't treated fairly, equitably. We know the correctional system is not inclusive. And we've seen that in the way trans folks are treated, the overuse of solitary confinement to punish trans people, and the terrible effects of that. The way the criminal justice system just treats LGBTQ people, where folks are placed in cells, in holding cells, where how courts and how judges refer to individuals, et cetera. There's just so much disparities, and we know LGBTQ folks and trans folks in particular are overrepresented in the criminal justice system. And there are so many reasons for that, including higher levels of poverty among LGBTQ folks, especially trans folks, and any criminalization issues, whether that's the former criminalization of cannabis, the criminalization of HIV, criminalization laws that put LGBTQ people into contact with the criminal justice system. And so just a few of those areas I want to mention is, and I mentioned this before, but when it comes to defense tactics, a criminal justice tactic is to use what's called a panic defense. And proud to say that Illinois was the second state to ban the use of the panic defense, the gay and trans panic defense. And now we're up to 10 states, and I believe we're on the verge of the 11th state, thanks to Delegate Danica Rome leading the charge in Virginia. So I think Virginia is about to become the 11th state, and so really excited that Illinois on the defense side has curtailed these defenses. But when it comes to the correctional system, we know trans individuals are unfairly treated, abused in the criminal justice system, and we've seen that right here in Illinois. We've seen that with the cases of Strawberry Hampton, who was a trans woman who, until the very end of her sentence in the Illinois Department of Corrections, was only placed in men's prisons and experienced not just harassment, discrimination, and violence from other individuals detained in the correctional system, but from prison guards as well, and would experience solitary confinement when she would file a grievance or when she would make a complaint. And that's just an example. There are other cases. There are also situations where the Department of Corrections has withheld medical care. And so we have great partners who are fighting for the rights of trans folks in the Department of Corrections, including the ACLU of Illinois, Lambda Legal, and they're doing good work to make sure the system respects and recognizes the rights of trans inmates. But the big bill I wanted to mention that just got signed into law is House Bill 3653. And this is a major policing and criminal justice reform initiative led by the Illinois Legislative Black Caucus. And it passed the legislature in the lame duck session in early January this year, was signed by the governor, I think last week. And it grew out of, I think probably there were 30, maybe 25 or 30 hearings that the Legislative Black Caucus held in the late summer and fall, and really grew out of the George Floyd protests in June, July, August of last year, and the recognition that Illinois had to do something to correct the disparities and the systemic racism of the correctional system, of the policing system. And so through all of those hearings, through all of the testimony, the Black Caucus produced and came together for this piece of legislation, which worked its way again through the lame duck session in the final days of the 101st General Assembly, which is early January. And it does, so the bill as passed does some really critical things. I'd say most prominent, and you've probably heard about this in the news, it ends cash bail in Illinois. It ends the cash bail system, which was a system that determined your level of wealth and income if you would stay incarcerated pending trial. And so now courts have discretion to hold folks based on matters of safety, personal safety, safety to victims, safety to others, rather than your ability to pay. And because what would happen in the old system is folks couldn't pay the bail and they would stay incarcerated, and they would stay incarcerated, and they would lose their jobs, and they would lose custody of family, of their kids. And what we've also seen happening now with COVID's rampage through prison systems, folks who couldn't pay their bail will become sick from COVID as well. So Illinois is the first state to end cash bail, and pretty significant. I will also say one thing, there's some data reporting as part of this as well for the cash bail provision of the bill. And one of the pieces that we were able to work in is on the data, we would also be able to know the LGBTQ status of individuals who are detained pre-trial. Again, getting to those issues of data collection that we talked about. But the bill, it institutes, it bans the use of chokeholds. It brings more accountability to law enforcement. There's a duty now to intervene if a police officer is violating the civil rights of another person. And so there's so much in this bill that I couldn't possibly explain it and do it justice, but it's really significant. And I will say, you're probably going to hear a lot of myths about this bill as well, of what it does and what it doesn't do. Equality Illinois supports House Bill 3653 and the Black Caucus efforts to really eliminate systemic racism in the correctional system, in the criminal justice system, in the policing system, because we know that is also going to impact Black LGBTQ folks as well, who experience those same discrimination, disparities, and harassment. So really a significant piece of legislation, and really applaud the Legislative Black Caucus for their leadership in passing this significant bill, and thank Governor Pritzker for signing it last month. And then just a criminal justice issue that we as a coalition are working on now is an issue around HIV criminalization. And Illinois is one of 33 states, I believe, that have an Illinois HIV criminalization law. And these laws, they criminalize people living with HIV for conduct that otherwise would be completely legal, like consensual sex or organ donation. And Illinois treats HIV differently than any other communicable disease, criminalizing HIV like no other disease is criminalized in Illinois, even if there is no actual transmission of the virus. And we believe, and the coalition of the Illinois HIV Action Alliance that we are part of, believes that HIV should be a public health matter, a public health issue, like any communicable disease, not a criminal issue. And so we've, as a coalition, we've been looking at this law, which has been on the books since about 1989, 1990, and how we can reduce prosecutions and how we can end the stigma that comes from a law like this. Again, where Illinois treats HIV differently than any other communicable disease. And just a few examples of how these laws in the Illinois HIV criminalization law, how it works and harms communities. It works against public health. For instance, you can be charged based on knowing your status. So if you know you're HIV positive, that could lead to a charge later on. If you don't know your status, you can't be charged. But good public health policy says you should be tested, because then you can get treatment. So the HIV criminalization law works against public health in that way. This law doesn't align with current science. Very simply, HIV is a manageable chronic condition in 2021, but this law makes no distinction on if somebody is undetectable and thus untransmittable, U equals U. It also makes no distinction on if somebody can access and use PrEP to prevent HIV infection. So the law works completely against current science. They don't work as intended. They can be abused. and they increase stigma and discrimination in the exact ways that I mentioned, especially since this is the only disease treated this way criminally by Illinois law. And the reason these laws exist is because in the late 80s and early 90s, when the federal government said, we will give states Ryan White money, which is money to support HIV/AIDS treatment and programming, but you also have to pass these laws, these criminalization laws. And so states did because states wanted access to that funding to support people living with HIV for treatment, for care, for programming. But what happened later on is the federal government pulled back on that requirement and no longer had the presence of criminalization laws be a requirement. But as many of us know, once you have a law like this on the books, it's really hard to get rid of. But we as a coalition, we've come together and said, no, this law should be repealed. We shouldn't have this law on the books. It's harmful, it's outdated, it's stigmatizing, and we should treat HIV like any other chronic disease using those proven and effective public health strategies. And again, HIV should be treated like a public health matter, not a criminal issue. And to that point, a law like the HIV criminalization law is really an impediment to helping the state of Illinois get to zero, which is the program that the state has to end new HIV infections by 2030. So, for all those reasons, we are pursuing Senate Bill 655, which is the bill to repeal the HIV criminalization law in Illinois. And it was introduced last Thursday by State Senator Robert Peters. And we're working in coalition with the Illinois HIV Action Alliance, which includes our great partners at the AIDS Foundation Chicago, ACLU of Illinois, Lambda Legal, Howard Brown Health, Chicago House, and really so many organizations, the Illinois Public Health Association, for instance, and so many other healthcare organizations, public health organizations, LGBTQ organizations, civil rights groups, really pushing to advance this repeal bill, Senate Bill 655, in the Illinois legislature this year. And we can get it done. We can get it done. And we're going to need all of your help to pass the HIV criminalization law. We're going to need all of your help to pass the repeal of the HIV criminalization law, Senate Bill 655. But we'll need your help to pass all of the bills that I mentioned earlier. And that's why I want to mention, and y'all are getting the sneak peek on this because we haven't officially announced this yet, but May 12th is going to be our virtual LGBTQ Advocacy Day. And it'll be our first virtual LGBTQ Advocacy Day. Usually we're in person at the Capitol. That can't happen right now. So we're going to have a virtual presence, and really excited. And I know Emily is going to follow up with you about registration links and what registration looks like, what that means. But in a nutshell, it means registrants would attend a virtual lunch program, a virtual evening reception, just like you would if you came to Springfield on an in-person lobby day, and then take 5 to 6 civic actions throughout the day, no more than 30 seconds each. And that could be click this link to send a letter to your legislator in support of repealing the HIV criminalization law. Or maybe it would be tweet out this message to a legislator in support of the REACH Act to ensure age-appropriate, inclusive, comprehensive personal health and safety education. So all of those things, it's, it's not like a traditional lobby day because you don't have to go to the Capitol and you don't have to sit in front of your computer for hours all day around advocacy issues, but you will have 4 or 5, 6 times throughout the day to take action, also attend that lunch program and then an evening program. So just really excited and hope y'all will join us, will sign up and look for an email from Emily about virtual LGBTQ Advocacy Day on May 12th. And with that, I am going to stop talking and answer any questions you might have. And just thank you for letting me bend your ear for 30 minutes.
Mike, that was great. I had a question. Do you have any sense of how the LGBT community in Illinois voted in the past election in terms of what was the rate of participation and how that compared with the broader state?
That's a good question. And I wonder if my CEO, Brian, would like to respond to that.
Sam, that is a great question. The answer is not yet. The data that we get through our partnership with the Voter Access Network has not yet been updated for the general election in 2020. We're not going to get perfect information, right? Because people don't kind of self-disclose sexual orientation or gender identity at the ballot boxes. But what we are trying to do is compare, we have access to a national model that scores the voter file for LGBTQ, likely LGBTQ equality voters. So it wouldn't distinguish between a consistent supporter who's an ally and a consistent supporter who is queer. But we're hoping to be able to get that information in the next couple of weeks and see.
I can't possibly have explained everything that well. So.
Oh, Mike, I just best wishes on your HIV advocacy and the proposed legislation. And I think you made some good parallels to the bill that was passed outlawing monetary bail, because that's something that advocates have been working on for. I remember my first conversation about that when I was at the county. Actually, it predates my work for President Preckwinkle at the county. That was back in 2013, I think. And so it had been a long time coming. So hopefully you meet similar success with your proposed legislation as well.
Thank you. I hope so too.
Any other questions for Mike? All right, well, you can always follow up with me if those come up, and he and I talk very frequently, so I can get those answers for you. Just to circle back, I realized that in my rush earlier, I didn't introduce myself. I'm Emily Boyce, Development Director. I know most of you, but thank you all for joining us. Thanks so much to Mike for this valuable information. I will be in touch about both Advocacy Day, as Mike mentioned, and our next session in April, which will focus on intersectionality. That session will be sort of the brown bag style. So we will invite folks to come presenting lessons that they have learned or questions that they have about furthering intersectionality within your workplace. I'm really excited about that one. And you'll hear more details soon. Once again, thanks to Mike. Thank you all for being here, and you'll hear from me soon. Have a great morning.
Emily, one other question, Mike, will you have like letter writing campaigns and things or like letters that people and organizations can sign as a part of this effort?
Yeah, I think so. And we'll definitely have it for the REACH Act. We already have with Planned Parenthood, we already have a petition for the REACH Act, and we will have that also for the HIV decriminalization bill as well. Those are, like, I'd say the two big priorities. So, and if it's okay, Emily, if you could connect me to Stephen, maybe after the event, we could just talk more. I can get you some more information. But would be happy to, absolutely, contacts to legislators, and also posting things on social media, because like the criminal justice bill that got signed by the governor, we expect that there will be probably some misinformation around the HIV decriminalization law as well. So any way we can counter those claims and those myths would be really helpful.
Great, thanks.
Great. I'll connect the two of you, and thanks for the question, Stephen. Okay, have a great day, everybody. Thank you. Bye.
Thanks, everyone.